that has entered medical conversations and policies in the last 15 years has been the potential legalization of marijuana in the United States. In an article published by Harvard Health, medical cannabis is currently legal in 37 states, and with 94% of Americans in favor of legal access to marijuana, it seems as if this treatment option is returning to the mainstream. This is a state-level decision as it is federally illegal, but has entered national conversations in terms of morality and effectiveness. But let's consider this. In 1 Corinthians 6:19-20 it says, "Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own, you are bought at a price. Therefore, honor God with your bodies." Is using marijuana honoring the Lord? Actually, to the surprise of many, it can be, when it is used ethically and morally within the confines of medical use for healing. Listen to all the ways that people can cope with severe pains, ailments, and illnesses. At 3 years old, Ashley Cern had her first ever seizure and was diagnosed with acute myeloid leukemia and began chemotherapy. While undergoing chemotherapy, it helped to cure her cancer, but she kept experiencing seizures almost daily. At one of her doctor's suggestions, she sought medical marijuana as a treatment. A landmark study published in the Lancet Neurology found that CBD, which is the non-psychoactive chemical found in marijuana, helped reduce motor seizures with similar success as traditional treatment, with 2% becoming completely seizure-free. Before switching to medical marijuana, Ashley was taking a concoction of drugs that made her moody, inactive, and sometimes almost unconscious. After switching to medical marijuana, life for Ashley greatly improved, as she did not have to live in fear of ER visits and the likelihood of more complications. It is stories like Ashley's that should give us pause and evaluate the good of appropriate marijuana dosages. The differences between medical marijuana and recreational marijuana can actually be rather confusing. To simplify, it is best to know the two main components of marijuana, CBD and THC. CBD is known for its medicinal uses, while THC is the component that alters one's mood and creates psychoactive effects. The most basic thing to understand is that medical marijuana has high positive healing results because it is high in CBD and low in THC, unlike its recreational counterpart. Across the United States, a debate rages regarding the medical industry's use of marijuana as a treatment for a variety of painful yet easily treatable ailments. Within this controversial argument, a truth exists. Medical marijuana is a suitable, reasonable chronic pain reliever that should not be disregarded in the medical community. This is agreed upon by state departments of health across the nation, research conducted by numerous medical journals, and scholars from respected educational institutions such as Harvard and Washington universities. A 53-year-old man struggling with chronic pain from fibromyalgia came to see Dr. Jacob Merman, Doctor of Internal Medicine at Life Medical in Minnesota. The patient was taking an opiate, oxycodone, which is highly addictive and can cause many life-threatening health problems, such as dyschezia, papillary constriction, and cough suppression. In addition, he was taking naproxen, which is highly addictive and can cause many problems such as ulcers and bleeding and holes in the esophagus. The drugs he was taking were not helping ease his pain and were causing more terrible side effects in his body, such as lowering his testosterone to a problematic level. Dr. Jacob Merman prescribed him medical marijuana in August, and by October, his pain levels had decreased extensively and he could quit taking his other prescribed drugs. He has not had any other side effects from medical marijuana. Medical marijuana has completely changed his life for the better. Medical marijuana is a suitable and valid treatment for chronic pain and should not be disregarded in the medical community. If medical marijuana is forced to suffer the side effects of recreational marijuana, patients with chronic pain will needlessly suffer. Why would anyone be in support of this motive? Without proper information and education on the differences between recreational and medical marijuana, chronic pain sufferers will question doctors' expertise and even written prescription. But why do patients hesitate to follow doctors' orders? People do not want to take marijuana because they think of it as an illegal street drug. If marijuana would have never been characterized as an illegal drug on the street, this would never have been an issue. Think of the drug fentanyl. People use fentanyl daily for pain relief, but fentanyl is characterized as an illegal street drug, so why do people continue to use it? Marijuana should be used solely for medical purposes rather than being used recreationally for leisure. These medical purposes include neuropathic pain, chemotherapy-induced nausea and vomiting, spasticity from multiple sclerosis and spinal cord injury, palliative and end-of-life pain. The most common use for marijuana in the United States is for pain control. Medical marijuana can treat pain, anxiety, nausea, epilepsy, and insomnia. It can lower blood pressures and reduce inflammation. It can treat generalized anxiety disorder, social anxiety disorder, panic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. The health of our families, friends, neighbors, and peers is of the most importance. More than anything, people want good health. Therefore, wouldn't marijuana be a perfectly suitable option as it gives the patient the better quality of life? People are concerned and possibly confused about using marijuana because there are two different terms, medical marijuana and recreational marijuana. However, no matter the context in which the word marijuana is used, people start to feel uptight. But maybe the issue lies in the terminology. According to the Mayo Clinic, while the FDA has not approved of cannabis use for medical purposes, they have approved of cannabinoids such as cannabidiol or dronabinol to use instead of marijuana. Would people be more willing to take a cannabinoid? Doctors can prescribe medical marijuana using alternate terms to create comfortability for their patient, and the patient should not be concerned about using that treatment. A solution to patients' hesitancy would be to eliminate the term recreational marijuana. There just needs to be medical marijuana or cannabinoids. If cannabinoids and medical marijuana both relieve chronic pain, then what's the problem with using marijuana medically? Recreational marijuana users only use marijuana because they like the feeling of getting high, whereas medical marijuana users only use marijuana for pain relief and medical reasons only. Medical marijuana users are not reporting the feeling of getting high or stoned. Rather, they are reporting the feeling of normalcy due to pain relief. In contrast to therapeutic effects, which include anxiety and pain relief, marijuana use recreationally can cause many life-threatening problems. In an article published by Hackery and Pekka, it is stated that licensed users, those who have a license to use marijuana, reported less hours feeling stoned and fewer cannabis use problems. They were more likely to report cannabis use patterns analogous to medication administration for chronic pain compared to recreational use. The moral issue with using marijuana is whether or not the benefits of using marijuana exceed the risk of using marijuana. According to the National Library of Medicine, marijuana has been around for 12,000 years. For example, in India, the god Shiva favored cannabis, and because of that, Indians used marijuana for different medical purposes. They used marijuana to treat pain, nausea, anxiety, improve appetite and sleep, and to relax their muscles. As I have previously stated, people today still use marijuana to treat chronic pain and other illnesses. If people used marijuana thousands of years ago, and several are still using it today, why are so many hesitant to continue to use it? Medical marijuana can also be used to help alleviate the effects of chemotherapy. Cancer is the leading cause of death worldwide, accounting for nearly 10 million deaths in 2020. If using medical marijuana can help treat the pain that cancer patients go through, then what's the problem with using it medically? Its positive effect in reducing seizure symptoms and seizure frequency is well documented. People say that using marijuana has helped treat their pain more than any other drugs that they first start taking. Evidently, there are more reasons to use medical marijuana than just pain that can be successfully treated with medical marijuana. Medical marijuana should be used as a treatment for chronic pain rather than being used for recreational and often addictive purposes. Overcoming the stigma that marijuana has gained over the decades poses a real problem that medical practitioners are going to have to overcome in order to most effectively treat their patients. After all, that is their absolute duty. It is no secret that marijuana has a negative stigma, contributing to why it is not legal in any shape or form in 12 of the 50 United States. This has been an issue because people were overprescribing it, and there were unfounded narratives regarding the use of marijuana that have now been disproven. It has been entirely illegal for almost 60 years. People were using marijuana non-medically, which lead to health problems, rather than using it medically, which lead to health benefits. While the negative effects of marijuana should be investigated, doctors, patients, and caregivers must keep in mind that the negative effects only happen when overusage occurs. Laura Stack is the mother of Johnny Stack, who tragically took his life while under the influence of marijuana. Laura and Johnny lived in Colorado, where marijuana has been legal for recreational use since 2012. In this state, residents are issued a medical marijuana card by going to their health provider and simply asking for one. Johnny used a friend's medical marijuana card at age 14 to obtain his own marijuana. And at 18, he received his own medical marijuana card to buy marijuana, but he did not have any medical or mental conditions. The truth is, he just wanted to get high with his friends. At age 19, Johnny committed suicide after becoming psychotic from dabbing high THC pot and had later been diagnosed with THC abuse by a psychiatric hospital. When using marijuana medically, there's an idea that it can lead to recreational leisure, thus making a way for addiction. While this is true at the surface level, the entirety of the truth must be fully examined. If a patient is using marijuana medically, how would that lead to an addiction if it is used within the constraints of a prescription? This could be the case with any drug. Just imagine if the same logic was applied to oxycodone, morphine, and methadone. None of these drugs should lead to recreational use when used within the constraints of a prescription. So how would medical marijuana lead to addiction if they're using it medically? The facts must be clearly stated regarding the differences between medical and recreational doses. Doctors prescribe 400 milligrams of medical marijuana per day, while recreational users take anywhere between 1,000 to 3,000 milligrams of recreational marijuana per day. If they only took the prescribed amount, there is no need to fear addiction. So many are afraid to use marijuana because they believe it is an illegal drug. Isn't any drug an illegal drug when it is used outside of a medical need? If marijuana was thought of medically rather than recreationally, then people would not be concerned to use it. Some may say that using marijuana in general, including medically, will cause addiction. In almost every incident, the person using marijuana overuses it as not using it medically, and that causes addiction. So if they use marijuana medically, then how will they get addicted? Almost every patient uses marijuana to ease their pain and they do not get addicted. Some may say that is because they barely use it. So if they barely use the marijuana, it eases their pain and they do not get addicted, then what's the problem with using marijuana medically? In the story about Johnny Stack, it is clear that he did not use marijuana for medical purposes and was only using it for recreational leisure for 4 straight years. If Johnny had taken marijuana medically, then he would not have built up an addiction to it. But because he took it for recreational use, he clearly got addicted. Laura Stack says that her son committed suicide while under the influence of marijuana. Yes, it is true that Johnny's story is sad, and it might cause others to not use marijuana, but should it? If marijuana is used medically, it should not lead to an addiction. Let's say Johnny used marijuana medically and not used it for recreational use, then he would not have got addicted. In his story, it is said that he committed suicide because he was so high on marijuana. But he liked taking marijuana because he liked getting high, so how would that make him kill himself? It does not make sense to believe that marijuana is the only reason that Johnny killed himself. Given that it is true that he only used marijuana because he liked getting high, it is impossible to believe that that is the only reason that Johnny killed himself. From the age of 14 to the age of 19, it is clear that Johnny used marijuana for recreational use, but all of a sudden, one day, while under the influence of marijuana, he decided to kill himself. Either the authors of this story are correct to believe that marijuana is the only bad factor in Johnny's situation, or because we do not know the full story, the authors could be telling us a partial truth to make us believe that marijuana is the only bad factor, but really it is not. Why is it that marijuana is the only illegal drug that patients are hesitant to use? Marijuana is considered a Schedule I drug. The differences between Schedule 1, 2, and 3 drugs is that Schedule 1 drugs are not used medically in all 50 states. Yet Schedule 2 and 3 drugs still have high potential for addiction. If people are not afraid of using people are afraid of using marijuana as a drug, but they are not afraid to take any other over-the-counter drug without thinking twice about it, when in reality you can easily overdose on over-the-counter drugs just as easier or even easily than marijuana. People are not afraid to use over-the-counter drugs, but they are afraid to use marijuana as a drug. If over-the-counter drugs help ease pain that patients go through, and so does medical marijuana, then what is the problem with using marijuana medically? Just as other prescription drugs should not be overused, marijuana should not be overused or overprescribed. Marijuana used medically benefits the person in more ways than marijuana used recreationally. Medical marijuana users have seen more positive results from marijuana used medically than marijuana used recreationally, so therefore, marijuana should only be used medically. Medical marijuana is a suitable, valid treatment for chronic pain and should only be used for medical purposes. Medical marijuana can treat many different disorders and seizure symptoms. It can reduce chronic pain and neuropathic pain. Since medical marijuana has high positive results, medical marijuana should only be used medically. Patients should not be hesitant to use marijuana medically. Thank you. I would now like to open the floor for questions. Oh, Mr. Davis.
I'm curious how you chose your topic.
Okay. Well, last year, whenever we were trying to figure out what we wanted to do, I was like, okay, Miss Schmidt, I'm not interested in anything. I do not know, I do not find any of these topics that you're giving me interesting. And she was like, well, I came across an article about medical marijuana, and I think this is very interesting. And so I looked over it with Miss Schmidt, and I was like, oh, that is kind of interesting. And I thought it was, I've said interesting 500 times, but I thought it was interesting how people are so afraid to use it, but it can lead to so many positive results. So it's why would they be hesitant to use it? It's the more I researched it, the more I was like, oh yeah, maybe I should do this topic. So.
Thank you. One more question. I have a second question with it, but is the marijuana from the dispensaries approved by the FDA?
I have no idea.
Because I'm curious why you have pharmacies for opioids, all that kind of things. You have dispensaries for medical marijuana. I'm just curious in your research about anything why that was the case.
No, sir, I did not find that in my research.
I've enjoyed working with you on this paper. It was not a topic that I knew about a whole lot, and so I've learned a whole lot. One of the things that I'm curious about, you listed several things that medical marijuana is a benefit for. Disorders and pain relief, anxiety disorders. I'm curious if in your research you came across anything where medical marijuana is not indicated for use. Is there, conditions or things that would not be prescribed?
Yes, I found that if you should not use marijuana when you're pregnant because it can cause many terrible side effects. But also that's the case with any drug you should not be using whenever you're pregnant, and so that's what I found about that.
That's an excellent job. Is in your research, did you find anything on the percentage of the rate of addiction to medical marijuana versus other prescribed opioids?
No, sir, I did not find any of that in my research.
Really proud of you, Callie. Well presented.
Thank you.
You mentioned a few statistics about how marijuana has kind of developed in the United States. Did any of your reading or research take you to other countries, whether it's legal and how long and how that's played out elsewhere? Did you read anything about other places?
No, so I just looked at the United States, and I looked in Colorado because that's where in the story about Johnny Stagg it was in Colorado.
Sure.
So I just looked at
Sure.
the United States.
Yeah, thank you. So then just one other question. I really appreciated you mentioning the verse from 1 Corinthians in the beginning, and I thought, wow, when she's reading that, it almost sounds like she's about to say, no, no marijuana because our bodies are a temple of the Holy Spirit. But then you did it, and you wanted to nuance that. Are there any other Bible passages that come to your mind as you think about proper use of marijuana and honoring God in the way that we in the way that we both use medicine but also live in the world? Did any other Bible verses come up in your research or thinking?
No, sir, not that I can think of right now.
Thank you.
You're welcome.
Good.
Okay, well, if there's no other questions, thanks for listening.